Hello, everyone, and welcome to the TMA Ask the Expert podcast series. Today's podcast is entitled Quality of Life in a Wheelchair. My name is Erin Coriel, and I will be co-moderating this podcast with my colleague, Gigi DeFibri. The TMA is a nonprofit focused on support, education, and research of rare neuroimmune disorders. You can learn more about us on our website, myelitis.org. This podcast is made possible in part through the generous support of Alexion Pharmaceuticals Incorporated. Alexion Pharmaceuticals is a global biopharmaceutical company focused on serving patients with severe and rare disorders through the innovation, development, and commercialization of life-transforming therapeutic products. Their goal to deliver medical breakthroughs where none currently exist is driven by the knowledge that people's lives depend on their work. This podcast is being recorded and will be made available on the TMA website for download via iTunes. During the call, if you have any additional questions, you can send a message to the chat option available with GoToWebinar.
Thanks, Erin. For today's podcast, we're pleased to be joined by Janet Dean, Alan Rucker, and Aaron Michael. Alan Rucker grew up in Bartlesville, Oklahoma, and went to Washington University, St. Louis, and Stanford. He was an award-winning writer in television through the 70s and 80s. In 1996, he became paralyzed from the waist down via TM. Post-paralysis, he has written or co-written many books, including 3 books on The Sopranos, a memoir with Kenny Rogers, and his own memoir of life after paralysis, The Best Seat in the House. The latter was a New York Times editor's choice. He is currently working on a book with network programming legend Fred Silverman. He writes for New Mobility magazine and the Christopher and Dana Reeve Foundation website. He's also chair of the WGA Writers with Disabilities Committee and the annual Media Access Awards. Janet Dean is a pediatric nurse practitioner at the International Center for Spinal Cord Injury at the Kennedy Krieger Institute. She attended nursing school at the University of Michigan, completing a master's degree in parent-child nursing in 1979. She is a board-certified pediatric nurse practitioner and is also a certified rehabilitation registered nurse. She has over 30 years of experience in the specialty of pediatric rehabilitation. Prior to becoming a nurse practitioner, Ms. Dean enjoyed 10 years as a staff nurse on a pediatric rehabilitation unit caring for children with physical and developmental disabilities. Currently, as a nurse practitioner for the International Center for Spinal Cord Injury, she specializes in the prevention and treatment of the common health consequences of pediatric spinal cord injury. She has a special interest and expertise in the evaluation and treatment of very young children with spinal cord injury and children requiring ventilator assistance. She's also interested in assisting adolescents with pediatric onset of spinal cord injury and helps them complete a successful transition to adulthood. Aaron Michael is the manager of patient advocacy and special programs at the International Center for Spinal Cord Injury at the Kennedy Krieger Institute in Baltimore. A graduate of Ithaca College, she holds both a master's and doctorate of physical therapy degrees. She specializes in treating paralyzing neurological conditions, including multiple sclerosis, transverse myelitis, cerebral palsy, and traumatic brain and spinal cord injury. She has been a certified assistive technology professional since 2011 and a certified seating and mobility specialist since 2012. Erin is the coordinator of the International Center for Spinal Cord Injury Seating and Mobility Clinic and has been specializing in seating and wheeled mobility for 9 years. Welcome and thank you all for joining us today.
Okay.
So just to start, I was hoping we could have Alan maybe just discuss his story a little bit and experience with having TM and life in a wheelchair.
Okay. I got TM almost exactly 20 years ago in 1996, and it came, like most people, just out of the sky. I like to say it's like an anchor that fell out of the sky and hit me in the middle of the back. And I'm paralyzed at the T10-12 level, and my paralysis, I'm exactly the same today as I was the day I entered Cedars-Sinai Hospital 20 years ago. My experience, I wrote a book about my experience. It was very difficult at first, and it takes a long time to kind of to adjust to this. People don't, especially people kind people around you, kind and loving people around you will think that you're over this in about a month and it's time to get on with your life, and why are you sitting there staring at the wall? And they don't realize that this process is a long, long process of recovery back to normalcy, whatever that is. And so it took me a good, 2 or 3 years. Anyone listening who's just contracted TM and is dealing with that, give yourself time and insist that other people give you time, because there is no, 5-step solution to dealing with this. I like to say it's more of a creative act than a following instructions. You reinvent your life, and sometimes that can take a long time. So give yourself time. And I did give myself time. And as I said, I wrote a book, and that made a big difference. And getting involved with the TMA made a big difference. And getting out in the world made a big difference. And now I feel, 20 years later anyway, a lot of that early emotional pain and lack of dignity and all of that has pretty much gone away. Anyway, how's that for a little start?
That's wonderful, Alan. Thank you so much for sharing. And
Sure.
we've all I looked up your bio, and we noticed that you've had a lot of speaking experiences, and if you would maybe elaborate a little bit more on that. I think we even saw you on, was it the Maury Show that you appeared, and how that was for you?
Yeah, after I wrote the book called The Best Seat in the House, how I woke up one Tuesday and was paralyzed for life, I kind of began getting people asking me to speak, and which I really love to do, and it's usually it's the story that I just began to tell, at least in part. And I was on the Montel Williams show with my wife, and the great moment in that was when Montel asked my wife unexpectedly why she stuck around when all of this horrible stuff happened, and kind of caught her off guard. She said, well, I guess it's because, we've been together for 30 years and I didn't know what else to do. And it was a valid question, actually, because it was a very difficult transition. It's a very difficult transition, not only for the patient, but it's a very difficult transition for the people around them. In my case, all of a sudden, I was the sole breadwinner in the family. I'm laying there on my back at Cedars-Sinai Hospital, not knowing what the heck's going to happen. And it's very alarming to have kids in college and grandmothers living at home and stuff. And it was very tough on my wife, and it took her quite a while herself to adjust. So everyone here demands needs time to adjust. And so I go around and I talk and I tell the story, and it has a happy ending, because I'm here talking to you, and disability has kind of become disability rights or disability advocacy or something. It's kind of become my life, or at least a good half of my life. I still write books and stuff. And it's almost like a blessing. There's Janet, you probably know this, there's a study done called the Moore study at University of California, San Francisco, which is a medical school, where they asked people with MS, pretty much like people with transverse myelitis. They did a survey and they asked people how they felt like 2 years later, and 62% said it was, if not the best thing that ever happened to them, it was a real positive experience. It made them closer to people. They felt better about themselves. They had passed this test, so to speak, and people were even more ambitious. So there's a positive side, believe it or not, to getting to all trauma. Although it's hard to tell someone in the first 2 or 3 years, hey, this is going to work out great, don't worry about it, because they don't want to hear that. Anyway, how's that?
Thank you for sharing. I think it's really important to hear, especially for people who this experience is just happening to them. It's good to hear that there's a future out there, and that there's ways to adapt and continue on with your life and stuff. So thank you for sharing. We really appreciate it. And then, so I was just wondering from, if I could hear from Janet and Aaron about, why this topic is important to them. So Janet, do you mind starting?
Sure. So I'm a pediatric nurse practitioner, so my focus naturally is on children. And I think looking at, life in a wheelchair and seating and mobility for children, there are some important considerations that are specific to children that you have to take into consideration. And a lot of that is their growth and development. And this can include both physical growth and development and cognitive growth and development and socialization. And that finding the best, mobility equipment for children requires sort of a balance of all these considerations. And particularly with current, climate and funding limitations for advanced technology, you need to give careful consideration for, wheelchair selection.
Sure.
In infants and for infants and young children, independent mobility is really critical for development. It's been linked to growth in brain structures, self-awareness, development of initiative and competence, and also cognitive function. We know that without independent mobility, children have decreased ability to learn, decreased socialization, and even learned helplessness. So for really young children, we often like to start using mobile standards because walking is a developmental milestone that you see at about a year to a year and a half of age. So we often may use these prior to a wheelchair, so we can allow children to be upright to explore their environment. In the past, for very young children, they didn't get wheelchairs until they were 2, and power mobility you didn't even think about until somebody was near 3 years of age. But now this isn't really any longer the case. For really young children, we can even start 7 months to a year with mobility, independent mobility. School-age children, we're looking at the ability for them to keep up with their peers. And often school-age children do best with a variety of mobility equipment. They may use forearm crutches if they can, do some ambulation, maybe at church where there's good adult supervision, or they may use a walker at school where the hallways are crowded, and then having a wheelchair so they can be the first kid to the playground rather than the last kid, or if they can have long distance mobility, participate in gym class is really important. And as children grow and develop, you need to balance prevention of orthopedic issues, such as shoulder wear and tear, which may require power mobility, or with the ability to strengthen trunk and upper extremity muscles that a manual wheelchair might provide. We also need to think about scoliosis and hip issues and balance the need for supportive equipment that'll prevent progression, but also may make it more difficult for a child to transfer. And then lastly, when you're thinking about teens, we want to think about socialization and independence and accessing the wider community, their ability to interact and hang out with peers. You also need to be thinking ahead, because new wheelchairs are only like 3 to 5 to 7 years. So if you have a preteen that needs a new wheelchair, you want to think about access to independent driving. Will it be a wheelchair that'll be appropriate that they can break down and get in a car? Will they be going to college? Will they need, if they're a manual wheelchair, will they need power assist in a hilly campus? Or if they're entering the workforce, might they, at that time need power mobility? So these are all the kinds of things that, I know I'm thinking about, and the reasons why I find it really important to make sure that we have a seating and mobility equipment that specializes in working with kids with injuries in the case for children. So that's where Aaron comes in our seating clinic.
Nice segue there, Janet.
Yeah.
So cue me, Aaron Michael. So as Gigi mentioned, I'm a physical therapist by trade, I guess, but then I got into the area of specializing in seating and mobility at my first job before I even came over to Kennedy Krieger. But when I look at this topic, quality of life in a wheelchair, there are so many different parts to that. And just to be clear for everyone on the call, I myself am not in a wheelchair, but I've spent a significant amount of time and part of my career working with people who are in wheelchairs. And I think my areas of specialty, each of them individually, I'm passionate about them for this reason, quality of life, for all wheelchair users. I think a big thing, first and foremost, I specialize in seating and mobility, and quality of life in a wheelchair starts with the equipment that you have and ensuring that it gets the user the most access to the most environments that they are in, and that, as Janet was mentioning, some of the medical issues, some of the social issues, those can all be supported by the equipment. So we want to be sure that the equipment that you have meets your needs and even exceeds your needs. Because as Janet mentioned, there are also time limits these days on what insurance allows and how often they allow equipment to be replaced. So we need to be thinking broadly about what someone's potential is and what they may be doing, whether they're going back to school or to work, or they're a parent, or I mean, the list of possibilities is very long and hopefully limitless, and so we want that equipment to support that idea. As my title suggests, Manager of Patient Advocacy and Special Programs, I also have taken on the role of managing our advocacy program here at ICSCI. And a big reason for that, again, is this quality of life piece. We know that we could be doing better with legislation that impacts people with disabilities. And so I'm working really hard, that's an area of passion of mine, to ensure that people with disabilities are recognized and that the laws are recognizing what they need to meet their full potential. And then I think another part of the special programs piece of that is I do a lot with adaptive sports and recreation event activities, and so that for me is a huge area of passion of mine, because it totally changes outlook when you give somebody access back to activities that they may have enjoyed, even if they're older and it was things they were into, sports or recreation type activities before their TM or their other accident or whatever has resulted in the paralysis occurred. And then for kids who maybe this occurred before they really got an interest in those types of activities, but the big thing about doing this type of adaptive activities is that it takes the can't, that awful word can't, out of the equation. I think so often people hear after an injury like this about what they can't do anymore, and that really stomps on someone's hope, and it really stomps on someone's potential when they're constantly hearing can't. And so adaptive sports and rec, a huge goal of adaptive sports and rec is to modify the activities so that anyone can participate in them, no matter their level of function. And really, you can basically modify almost any activity in order to accommodate someone with a different level of ability. And so, and again, sometimes coming back to the wheelchair, a lot of those adaptive sports and recreation activities require wheeled equipment or other types of modified equipment. And so again, we're coming full circle to where the fit of the equipment really makes a huge impact on someone's level of function. So that, I guess, to me is really why I'm passionate about this topic. I think for me, really at the end of the day, my goal and my goal long term is to take the DIS out of it and focus on everyone's abilities.
Great, thank you so much. A theme that I'm hearing from all of you too is, so for example, I always thought of a wheelchair when this first happened to me as this limiting thing. Oh, I can't walk anymore, so I need to use a wheelchair. But it really can be very, it can help you do so much, and having the right wheelchair can really open up so many things, and it's not limiting. It enables things. So I was just wondering if we could talk a little bit more about what's the best way to go about getting a wheelchair, and what should be considered when getting a particular wheelchair to really help get people in the best sort of situation. So Erin, if you could just talk a little bit about that.
Sure. So if possible, if and when possible, I really encourage people to get to a seating clinic. And I know that's not possible for everyone, because sometimes people, if you live in a more of a remote area, you may not have a hospital system or something near enough by to do that. But if there's a seating clinic in your area, that gives you a full team. There's a therapist there, and then there's the wheelchair vendor that provides the equipment. They'll do the full evaluation, and then you take a team approach all the way through. But if it's not possible to be at a clinic, if you can have a therapist involved in the process, that always helps. Therapists are, we are trained to specialize in the body, and we can help guide that process. But at the very minimum, getting involved in a company that provides wheelchairs and has an ATP, or an assistive technology professional, on staff, their job is to help evaluate you for that equipment. And then, the team approach is always best when there's multiple people and multiple experts who can help. The therapist kind of serves as the liaison between the wheelchair user and the wheelchair company, to ensure that the needs of the end user are being met. And then, of course, as the wheelchair user, your own personal experiences, it's really important to relay that information. And when going in for your first chair or your next chair, or making sure that you have a list of the things that are important to you and what you want to be able to accomplish and what you want that equipment to help you accomplish. And if it is a second chair or a third chair or a 10th chair, or letting them know what you like about the current equipment that you have and what you wish you were different, or what about that equipment helps you function and what about it is limiting to you. What's something, think in your daily life about things that currently you're restricted in doing, or maybe worse than restricted, maybe you can't do them at all. If there's certain rooms in the house you can't get to, or vehicles you can't get in, or thinking about different things in your daily life that are difficult because of being at the wheelchair level. And then the team can work with you to try to problem solve about how we could make those things easier, and how we can make the equipment function better for you.
Thank you so much, Erin, for sharing that useful information. And so, Alan, if you could share your experience with getting a wheelchair, and then maybe some advice that you might have, for someone who is getting their first chair.
Well, I never even heard of a sitting center, so that was news to me, because I guess there probably weren't that many 20 years ago. But I depended entirely on a vendor who is still my vendor 20 years later, who helped me figure out the right chair and be comfortable in it. And I've never really had any problems with the chairs that I have. I only use manual chair. I've never used a power chair. It's some psychological thing with me. We have to get Dr. Freud in here to explain that to me. But one of the reasons is because I was very athletic before I became paralyzed, and I wanted to maintain some form of, athletic life. And it's not that hard to do in a wheelchair. It's just different. Working out, I work out every day. I recommend people in wheelchairs work out every single day. Some form of exercise. I roll around the neighborhood and scare people. That's what I do. No, I just think it's critical, you know, upper body exercise, stretching. What happens in a wheelchair, I'll get back to the actual chair in a minute, but what happens as everybody on this phone knows is that your shoulders get a lot of wear and tear. And if you're an older person like I am, they usually break down in some way. I've had rotator cuff tears on both arms, and not severe enough to go in and get surgery. Since I don't really want to go in and get surgery, as my ortho guy said, if you get surgery on one shoulder, you're just going to be going wheeling around in circles for the next 6 months. So I don't want to do that. But I've always, you know, just the best chairs you can get. TI are the chairs I use. I think what's really critical, and I don't think people talk about this enough, is the actual seat, the seat you sit on, because there's lots of variations on seats. And if some seats come up on the side, you know, kind of like you're in a bucket seat in an old Mustang or something. And to me, that creates a lot of transfer trouble. Transferring is pretty much the whole business. That's where you're going to put most weight on your arms. That's where you're going to slip and fall if you don't really have it down. And so I would really say, make sure you have the right seat. With the TI wheelchair that I have now, I have the seat that was made for the wheelchair, and that's really critically important. Otherwise, you just have to have a good repair person. That's also really critical, because things break down. It's a machine. It's like a bicycle. You know, things break down, and having a repair person nearby who can help you, or at least, you know, guide you, is a really important thing.
Mm-hmm. Yeah, and if I might say one thing, this is Erin again. I think another important thing to remember is that however you're going about the wheelchair evaluation, whether it's just with a vendor or you are in an area where you can get a team, making sure that you feel like it's an individual process, and that you're being evaluated thoroughly as your individual self. The wheelchair process should not be a cookie cutter type thing.
Right.
The person coming to see you should not be coming in with an equipment list before they met you. The equipment list should be developed during the appointment, once they're getting to know you and your body. And so that's another thing that I always think is important, and I try to let our clients know who come to our seating clinic is each patient that I see is different, even if they have the same exact diagnosis with the neurological system. There are so many variables, and so and even just the human body in general, no two people are the same. And so you want to make sure that is being acknowledged, and that process is being individualized to you and your needs, and look out for the little red flag of somebody coming in with the list already, or with equipment already designed for you before they've even gotten their hands on you.
Yeah, so yeah, thank you both very much for all of that information. I mean, I think it's very valuable to hear that it has to be this individualized process, especially also, everyone's different, and then, your function can change over time too. So I definitely hear that. So related to seating as well, we had some questions about pressure sores and how this can be avoided, with seating. And if there's certain cushions that are recommended. So to start, Janet, do you mind just giving a brief overview about pressure sores and how they come about?
So pressure ulcers are generally come about because of pressure, obviously, and they can. That's not completely true. Pressure ulcers. Pressure is certainly the biggest contributing factor, but other factors that contribute can be shear, like if you're dragging your bottom when you transfer, There can also be issues due to, like, if you're having any difficulty with incontinence or sweating, so that your skin is, kind of softened and more vulnerable to breakdown. But generally, pressure ulcers occur when a bony process, such as your sit bone, is being compressing the skin between that and a wheelchair cushion, and it really only takes about 20 minutes before you can start to have problems with the lack of circulation to your skin, and you can start the process of a pressure ulcer. And the difficult thing about pressure ulcers is that because it is a bony process compressing between the skin between a surface, is that sometimes it can be way worse on the inside than it is on the outside, and so you can have a pretty bad ulcer before you really even know it, and can suddenly have a big open area. So having appropriate seating is really, really, really important. And one of the things that I think I find so frustrating is if I do have a patient that comes in for me to look at a pressure sore and tells me that they're having an issue with pressure, and they have a sore on their seating area, and then I look at them and sure enough there's an issue, and then I look at their cushion and you can tell that even me not being a seating person can smush around on the cushion and usually see that the cushion is worn out, or that it's not necessarily that the person wasn't doing good pressure relief, but that they're having an equipment issue, or that they've grown, or that there's something rubbing, and then trying to get the repair done can be a lengthy process, and wounds can get worse. And so that is frustrating to me as well as to the individual that's having this issue.
Can I weigh in here?
Oh, sure.
Is that okay?
Mm-hmm.
Okay. Pressure sores are the bugaboo of being in a wheelchair your whole life. And funny, I've never had pressure sores on my tail, like many people have, because of what Janet said, poor seats or whatever. But I've had plenty of pressure sores on my ankles and on my, especially my legs and ankles, and even on my side. And it is the very first thing you have to learn, which is how to manipulate your body so that you don't have pressure. It's easy to lay down and your leg maybe bend a little, like mine do, because I have a little contracture, and all of a sudden, as she said, 20 minutes later, there's maybe a red spot. You don't think it means anything, and I've been in the hospital many times where it's meant a lot, including surgery for necrotizing fasciitis, which is a terrible kind of infection. And you just really have to pay attention to that more than I think virtually anything. Just pay attention to where you're applying pressure needlessly, because there's ways to adapt to that. And it really took me a long time. I guess I'm a slow learner, because it took me a while before I realized that these things are a nightmare, and you definitely you want to stay away from them. And so that's my advice: stay away from them.
Yeah. So if I guess I can take more of the how to prevent them through your equipment. First and foremost, I want to say, we've been talking a lot about wheelchairs and pressure sores, but I want to defend the wheelchair a little bit and say that it's not always it's not always the wheelchair. So it's important to consider all the surfaces that you are sitting or laying on throughout the day, and also your clothing choices. The more layers that you have on, the more risk that there is of skin breakdown, and considering what types of pants you're putting on. Sometimes there are pants that have buttons on the pockets or zippers, or and any of those, or even the undergarments you're wearing, just being careful of how those are positioned against your body. Any extra layers can cause a wrinkle or an increased area of pressure, and then that's what's going to result in a breakdown as well. So just keeping in mind what kind of clothing you're wearing when you're in your chair. As far as what cushion is best, there's not really, again, I'm going to go back to it being a very individual process. There's not one cushion that I could sit here and recommend for every single person, because that's just not how the body is, based on your anatomy and your the layout of your tissue and your muscle and your bony anatomy. Every person's different, and so it may take doing some equipment trials to find out which is the best cushion for you individually, because there are multiple factors. As Alan hinted on, there's transfers can be affected by cushion type, and your sitting posture and stability can be affected by cushion type. So it's not just pressure relief that we're taking into mind when we are doing a cushion recommendation. So really, again, a good evaluation, if you can get into a place that has pressure mapping. Pressure mapping, I'm going to say, it's a good tool. It does not tell the entire story about the cushion, but it's a mat that you can sit on, and it lays out the pressure underneath your bottom while you're in your wheelchair. They even have them for the bed or for other surfaces. And so the mat is placed between you and the surface that we want to check out, and it gives us a picture of what your body looks like and where the pressure is laid out and where it's worst. And we can kind of modify your sitting based on that. Now, I will give a little caveat that the research is a bit variable behind pressure mapping. So again, as I said, it doesn't tell the whole story, but if it's something that you've been struggling with pressure for a while, it may be worthwhile finding a place that has a pressure mapping system and can do that test for you along with the other portions of the evaluation to try to find the best equipment. And then another thing that's really important is pressure reliefs. And so when someone with sensation sits in the same position for a prolonged period of time, we will naturally move, because our body, whether we really understand it or not, our body is telling us that it's uncomfortable, and so we naturally shift, and that helps bring the circulation back to the tissue. But if you sit for a prolonged time and you do not have that same level of sensation, your body does not understand that it's uncomfortable, and you don't naturally do those shifts. And so a manual wheelchair user should be doing either anterior leans or lateral leans to try to unweight their bottom. Back in the day, everyone was told to do press-ups through your chair, either through your armrests or the tires of your chair. Research into upper extremity preservation shows us that that's not the best method, because that actually puts a tremendous amount of stress on every joint, your wrist, your elbow, and your shoulder. And then
now you tell me.
Yes. And then now in a power chair, a lot of people who think they're doing their pressure reliefs in their power chair are not going far enough back. You actually need to be doing a full-on tilt all the way back until tilt stops. And if you have tilt and recline on your chair, you really should, once you tilt all the way back, be putting a little bit of recline in your chair. And the most annoying thing about pressure reliefs, the research shows that they really need to be 2 to 3 minutes long, which is another reason why holding that lift on the armrest is really not realistic. That's a really long time to hold a static position like that. That takes a lot of strength and endurance. And the other thing is they really should be happening every 20 to 30 minutes. And so, and I know if we polled the general audience, most people do not do their pressure reliefs for that long or that frequently. And so, and not every person, every person's different. So some people are naturally just a little bit more susceptible to skin breakdown than others. And so knowing your body and doing your skin checks regularly and keeping on top of your own health and taking responsibility for that is a huge part of it.
Thank you so much, Erin. That was a lot of helpful information. So we received a question from our listeners, well, one of our listeners. So the question is, are there affordable and comfortable power chain wheelchairs, or is there a trade-off for, going with a more affordable one?
Ooh. So for someone who is in a chair full time, which generally a spinal cord injury results in full-time wheelchair use. We have some people who are partially ambulatory or maybe ambulate full-time, but generally for people who are in chair full-time, you really are losing out, cutting cost. Because those more affordable type power chairs are not meant for someone who is in a chair full-time. Starting with you cannot get customized seating generally on that type of chair. You may be able to change the cushion out on that style chair, but you usually cannot change the backrest and you cannot add anything to it, so any other sort of positioning or safety devices. And also that type of chair does not have the power seat functions that you need to do pressure reliefs, and really, the big thing is postural support. So for somebody, depending on level of injury, trunk paralysis has a very negative effect on your ability to maintain good trunk posture, and puts you at risk for scoliosis and pelvic obliquities and other postural deviations. And then, of course, the worse that a scoliosis gets, the higher risk you have for other things, because that starts crowding inside your abdomen, and then that starts impacting organ function and respiration and your heart and your digestion. Your whole body is interconnected, and so we're really concerned about those types of secondary complications. And so you cannot get this kind of support that you need in that lesser piece of equipment. Now, if it is somebody who is partially ambulatory and that device serves as they are using a wheelchair part-time, that may be something that would work, but again, it would take involving an expert in the process and getting the opinion of someone who specializes in this equipment, because those wheelchairs generally are meant for somebody who has some endurance issues. Maybe they have a cardiac issue, and I sometimes think of it as someone who is in an assisted living facility or in a community like that, where maybe they have a community dining area or something, and so inside their individual apartment they're able to function okay, but then to go those longer distances, endurance-wise, they just can't walk that far. But they're going to be getting out of that equipment frequently throughout the day, versus somebody who's going to be sitting in it for full time. You really need that better support and access to those seat functions to help you with pressure release and position changes and so on.
Wonderful. Thank you so much. We also just had a question come in that says, can you talk about weight management and loss for people who are full-time wheelchair users? And maybe if Janet or if Erin, if you have some comments on this.
Erin, what do you think?
Erin. So I think, so there is, I mean, how do you answer this? So, um, again, I mean, I do work in a lot of adaptive sports and recreation activities, and there's now we're coming into a time period where people understand the need better and understand adapting activities and adapting equipment and working with people of different abilities. And so I actually do know that if you look out there on the web, there are more blogs and other types of social media accounts and things that are dedicated to adapting activities for people with different ability levels. It does become harder to manage weight and to get a workout when your body is now functioning differently, and it's harder to recruit muscles. But there's stuff out there. There's equipment out there that is specially designed for people with disabilities. We have some of those items here in our gym at Kennedy Krieger, but they are out there looking for a specialist, if that's a possibility for someone, to look for a personal trainer or a nutrition specialist, a dietitian who can help with managing intake and activity levels. It's important to keep in mind when a spinal cord injury, which TM results in a spinal cord injury, there's multiple body processes that have to be considered, and so working with a medical professional or a dietitian who has a better understanding of how a neurological condition impacts the body is a good place. Janet, if you want to chime in on any other thoughts you have.
Yeah, certainly, as I was talking earlier, it's, you're always balancing. Certainly, if you have the ability to be able to push a manual wheelchair, that at least gives some ability to burn calories more than in a power wheelchair. But again, that's not always a possibility for everybody, and then you're balancing that, against shoulder wear and tear and that kind of stuff. So maybe thinking about, like Erin says, as a wheelchair is the only means of managing weight. We really have to do a sort of a multi-step process, and we have participating in physical and or occupational therapy is one way of doing things. We also have we have personal trainers in our gym that have some specialty with spinal cord injury that often look at things from a different perspective than therapists or doctors or nurses, and we've seen some nice results from those kind of specialists. And being able to access the gym from a wheelchair, there is equipment that can be used, like in our wellness program, that's specifically designed for people in a wheelchair. But some people, I think, can access other gyms that may be able to access some of the equipment if you find a local personal trainer that's willing to work with you. So I think it needs to be more of a sort of a multidisciplinary and a sort of creative approach.
Yeah. And this, with my specialization in advocacy, this is a place where I'd like to chime in and just encourage people to be advocates for themselves. Sometimes it's not about, it's not that a facility does not want to help you, or that it's legitimately they truly do not understand your condition or the function of your body. And if you are willing to be patient and provide education and request assistance and kind of speak up for yourself and for what paralysis is and how and make it more of a team, feel of your body and what you're capable of, and then that person out in the community, whether some of our patients have had very good luck working with local fitness centers when they were just confident enough to kind of go in there and say, hey, I really want to work out, but I'm not quite sure what to do, and just like any other person who would come into the gym and it has never been to a gym before or is not comfortable with gym equipment, but just being willing to kind of educate them more about your condition and how your body functions a little bit differently. And if you advocate enough, it may take a try or two or three, but if you're willing to go out there and try, you'll run into somebody who is willing to work with you creatively to try to come up with a program. And so so I want to encourage people to do that as well. Don't be shy. Sometimes it's just legitimate. Sometimes it's just that person being slightly intimidated by the situation, and so helping them understand that you being in a wheelchair or in a different form of mobility device does not limit how you function or access the community, or and so you can find that person who wants to work with you to try to figure it out.
Can I chime in here?
Yes.
Yeah.
Mm-hmm.
Okay, you two are really nice about this. As someone who's been in a wheelchair for 20 years, I wouldn't be so nice. Do not gain weight while in your wheelchair. Do not eat as compensation for being in a wheelchair. It causes all kinds of problems. It causes pressure sore problems. It causes especially transfer problems. It causes energy problems. You have to conserve your energy. And carrying around a lot of weight. And I think food is more, I mean, I exercise, as I said, every day. And if you have the ability to do that, do it. But watch what you eat, you just don't just put away the chips and all that junk, because it really makes a difference in your life. Even more difference, I think, than it made certainly before because I'm an old man and I was a long time, I was just a regular Joe. It makes more difference now than it ever made then, both exercise and eating right, because you're just bringing on problems, and when you're in a wheelchair, you're bringing on more problems. I mean, if you're heavy, you're going to fall more. When you fall, you also break your skin, just like if you have an ulcer. If you break your skin in the wrong place, like I did when I took a fall about 3 years ago, it took 2 years for that wound to heal. 2 years. They finally had to go in and do flap surgery in order to get it done. That's because I fell, and I'm a normal weight. You're going to fall more if you're heavy, and if you fall, it's consequences. So I guess, ma'am, I'm just trying to give the same message with a little more urgency. That's all.
Well, yeah, and I think it's important to remember that now that your body is functioning differently, you're going to be burning calories differently as well, and not quite as effectively as prior to the injury.
Right.
And that's also another reason to consider meeting with someone who can help you with trying to learn how many calories your body burns now versus what it had burned before, and how to manage that with your food intake. So it's important to be able to reach out to experts if you have them available. I know again, some people being in more of a remote area can make that all challenging. But if you don't have that directly in your area, networking through a association like TMA to try to locate a specialist who may even be able to work with you. Nowadays we have the wonderful internet that makes places much more accessible, and so you may be able to network a little bit to find someone who can help you.
Fatigue is a factor. No one's brought it up yet, but it's a huge factor in your life if you live in a wheelchair. And anything that you can do to moderate that is, what's his name? Ben Greenberg in Texas said, listen, it takes more energy to brush your teeth when you're in a wheelchair. It takes more energy to do everything. It takes like 2 or 3 times as much energy. Think about transferring in a car. and you're going to get tired, I promise you, and you have to moderate that. But one great way to moderate that is to moderate your weight.
Thank you, Alan. I'm actually really glad that you brought that up. So we just have a few more minutes, and so Alan, I just wanted to ask, and of course Janet and Aaron, if you have any comments too. But what are some home modifications that you can recommend to improve the quality of life in a wheelchair in your home?
Put a ramp everywhere, and the government's not going to help you pay for them either. There's a lot of things you can do. For instance, if you have you can modify a bathroom sink so that you can get under it. Sometimes that may mean just cutting a hole in it, or sometimes it may mean getting a different kind of bathroom sink. Obviously, commode, an instrument you can put over the toilet is the easiest way to take care of that. And just, I don't know, except cutting holes in everything is one of the things we've done. Kitchen sink, bathroom sink, all those, so that you can get under them. But, I don't really use a lot of, obviously in a tub, you need something to hold on to, a grab bar. But I don't use that many grab bars myself, not as much as probably I should, or other people probably need to. But really make your life easy by if you have a living room that's 2 feet down from the dining room, put a ramp in. You put a ramp everywhere. It really makes life a lot easier.
Great, thank you. And then I just wanted to kind of open it up if there's anything, that we should have talked about that we didn't yet, that any of the panelists want to talk about.
Don't be afraid to take a nap. Don't think you're lazy. No, seriously, a lot of people go, well, I can't do that. Take naps. Naps are good. And I take one every day. First of all, you just get off your tail for a while, but also, you really is. You use up a lot of energy being in a wheelchair. That's a really important thing you have to manage, is your level of energy.
Mm-hmm.
Well, I talked a bit about children with spinal cord injury, but one thing we didn't address is aging with a spinal cord injury.
Thank you.
And changes in mobility.
Thank you for bringing that up. Yeah. Anyway,
that's my expertise, so I thought maybe one of you could.
Well, I am aging with spinal cord injury, so maybe I don't know. You just take a nap and work out and don't gain weight and watch out. It's basically the same thing. There is a point, I think, where if you're aging, and especially if you're not particularly athletic to begin with, that you're going to probably move from a manual chair to a power chair, because it really does take its toll on especially your shoulders. It's very hard to manage a manual chair when your shoulders give out. It hurts. I mean, it actually hurts me all the time. I have to stop and stretch all the time. But so there's probably a point where I won't do that anymore. I'll just get a power chair. But I'm not there yet, and I am 71 years old, so you can carry on for quite a while. Anyway.
Yeah, I mean, I think it's, I could probably talk about this part of the conversation for a while, but a general summary: if you are a manual wheelchair user, making sure that your setup is as for success, looking at efficiency and energy conservation. So on a manual chair, if you have the proper manual chair, your rear wheel should be fully adjustable, and we can position that custom for you to ensure that you are propelling as efficiently as possible. You really want to have less propulsion strokes, and so wheel position has a huge impact on that. If the wheels are too far back, you're not going to be able to make a full propulsion stroke, and that's going to increase your frequency, and that's going to affect shoulder health over time. Transfers, making sure that the transfers you're doing throughout the day, that you are efficient with transfers as you can be. So, limiting the excess transfers, because we know transfers are a very stressful activity. And again, home setup is huge. Limiting the amount that you're reaching overhead helps with shoulder preservation. There are some things that you can do in your environment to decrease lifting, to decrease reaching overhead, and then there are some things that may be available in the equipment. If you have a power chair, there are power seat elevators and power standers, manual chairs. There is a manual standing chair out there, but these items are hard to get covered through insurance, so that's a whole different conversation, but that type of equipment is out there. And also, and like Alan said, power chairs help to preserve upper extremities over time, because now you're not pushing. But really, if you're in a manual chair, setting that chair up as custom to you as possible, as well fitting to you as possible, and the rear wheel position custom to you. And there are systems out there that can help limit propelling. There are things that are called power assist systems that either supplement your pushing so you don't have to push as much, or they actually turn your manual chair into more of a power chair. So if you're out in the community or at work or where you're going to be going longer distances, you can really decrease the number of strokes that you have to take throughout the day. And yeah, it's a lot of consideration for how you have to use your arms, and decreasing the amount that you use your arms throughout the day to keep those. And anything that we generally do to in the general population to keep ourselves healthy as we age, as Alan indicated, working out and stretching and being mindful of your staying hydrated, all those things that we know keep us healthier. That will help you age better as well.
Wonderful. Well, thank you so much. So we've come to our 1 hour of time together. So we want to thank Erin, Janet, and Alan for joining us. And we've really learned a lot, and we appreciate you sharing your time and your expertise on this important topic. And for our listeners, you can visit our website, mylightus.org, for our 2017 podcast schedule. So thank you all again for being with us, and we really appreciate it.